Welcome everyone again to another Living Well presentation. I am so excited that you are here today to listen to another great presentation on how to take care of our bodies. Before we start, I just want to give a brief disclaimer. This presentation is for educational purposes only. The information shared is based on research, personal experience, and biblical, from biblical scripture. Our goal is to educate you on the topic, not to assess, diagnose, prescribe, or treat any medical condition. If you have any specific conditions or situation in which you are concerned, you're encouraged to seek advice from your personal physician. Again, this is for educational purposes only. I am so excited to have a special guest here today who is going to present a, a topic about women. Yesterday was National Women's Day, and we thought it so fitting for this topic to be discussed, Wonder Woman Health. So today, I want to introduce to you Joylin Isaac Shirley. She is a supervisor. She supervised over a women's health clinic here in the Central Florida area. She's an image technologist specialist for over 34 years. She specialized in radiography, monography, ultrasound, and many more radiology specialties. So she's going to present to us today the topic, Wonder Woman's Health. I am glad that I'm seeing young women, middle-aged women, and advanced age. I am glad that you are here to join us today. So with that said, the next person you're going to hear from will be Isaac Shirley. Thank you, Miss Shirley, for coming today to present to us and to share with us your knowledge, vast knowledge that you have on this subject. So thanks again for coming.
Thank you so much, Miss Emily. I appreciate it. And hi, everybody. Good afternoon. It's always a pleasure to see all these amazing people want to learn about our body. So today, let's get started. I'm going to share my screen. How is everybody doing today? Want to say hi? How is everyone doing? Happy Sabbath? Yes.
Wonderful.
And
Happy
everybody,
Sabbath.
and everybody wants to everybody had their little nap, after Sabbath. You have to have that nap. All right, and so I'm going to share my screen. Yes, right here. And I'm going to go share. Yes, great. And so I have been an imaging technologist for a number of years, as Miss Emily said. Imaging technology, we do like mammograms, ultrasound, breast biopsies, computerized tomography, x-rays, so it's like radiologic imaging. And I love what I do. I have a passion for breast health, especially. And as women, we sometimes forget ourselves. We take care of everyone else. We take care of the mom, we take care of our dad, we take care of the children, and we sometimes forget about ourselves, as I said earlier. We just have to, I just want to encourage us women just to take one moment of the day and just to sit and breathe and exhale, inhale, exhale, and just relax ourselves. Because let me see all those special women out there. Aren't we special, wonderfully made in God's sight? We are. God loves us endlessly, and He wants us to be healthy, as I said. And so today we can just talk about how to stay healthy. And I'm sure we're all aware of most of the things I'm going to say today, but it's just like an encouragement because a lot of times we know what we're supposed to do. I know I'm supposed to examine my breast every month, but sometimes I forget, And so a little reminder is really awesome for us sometimes. So we can talk about trying to stay healthy, eating the right healthy fruits and vegetables, exercise, really important, and a little bit of breast health or mammograms and or breast self-examination. And maybe we'll get a chance to touch on like bone densitometry. But let us all begin, and you can stop. I mean, I think there's a time when everybody asks question, but during the process, if you raise your hand or put something in the chat, we can pause sometimes to listen to what you might have to say before you forget your thought, or you can write it down. I think, Miss Emily, we wait until the end before we ask questions. I didn't remember.
Yeah, yes, we wait until the end and then ask question. Yeah.
Okay, so just write down your thoughts and so that we can follow it. And we all know about the water drinking, have water, choose water instead, just 8 glasses of water per day. This text I know is my favorite. It says, whether you eat or drink or whatever you do it all unto the glory of God. And that's taken from Corinthians 10:31. Um, 1 minute, my battery is dying here. Here. And so it's yes, whatever you do, whatever we eat, I apologize, or drink, do the glory of God. We have to choose to drink water instead of juices. I love juices. Anything sweet is amazing. And who don't like to have some sweet things to drink? But sometimes it's not necessarily the best for our bodies. We have our smoothies. It's good to get our juices and all of our stuff that we need to keep our bodies going. How many glasses of water a day should we take? Anybody knows? Approximately. Anyone want to answer that? How many glasses of water you should drink per day?
About 8 glasses of
Uh,
water, depending on
Yeah,
your.
that's what it says right there. Yeah, I give away the
Some
question, the answer. At
some
least
person,
eight
excuse
glasses of
me.
water. Sorry.
Hello, sorry. Some persons say half your weight in ounces.
Some people are okay.
Oh, half
Half
your
Some
of,
people are
weight.
waiting.
Mhm.
yeah, half your weight in ounces of water.
Say that again.
Half of your weight
Oh,
in
half your weight.
ounces.
Yes, yes, yes. Correct. Okay. Yes, yes, correct. Wow. I struggle with water, and I'm sure there have quite a bit of people out there. I really, really sometimes don't want to drink water, but then I know it's good for me. So I have to drink it. A lot of times there's things that we don't like, but it's good for our bodies. So we want to encourage you guys to go ahead and drink it. And then our fruits and vegetables. I'm not sure if you guys can see the screen clearly, but fruits, I mean, that's something again, I am not a big fan of, but I eat it because I know it's for our bodies. We need to eat at least one serving of fruit each day. Have our vegetables, if it's raw vegetables. And I mean, once you eat healthy, you will be able to live life so that be able to finish the gospel to be healthy so that we can there's no way we could tell someone of Jesus. And then we want our best to exercise. I had taken on this huge program about waking up in the morning, and walking every day, at least half an hour. And then I said, oh my God, in the morning it's too early. Let me try in the evening time. After work, I am exhausted. I'm tired. I want home and kind of fall behind on my exercise. And then so we have to just examine ourselves and see what's best for us. So I said, let's try about walking during my lunch. So during my lunch, I would have lunch, go walking, walk off that lunch, please, for half an hour. And you will be surprised to know the energy that I got or feel during the course of the day. So as you go through the course of the following week, if you haven't started, let us try some exercising. Have a little walk with the family. Take everybody, the dog, the kids, the husband, everyone can go walking and just enjoy the nature of life. Just every day you do just a little of it, even if it's 3 times a week, you'll be surprised to know what a difference that will make in your life. So enough about our walking, making sure we eat healthy. We're gonna go on to the breast part of it, and that's my favorite. And so I want to like this is interactive. I want everybody to join if you have to, answer the question. It says, breast self-examination. Let's see all those who examine their breasts every month. We're going to show, let me see the raise of the hands in the chat. Let's see if the chat has anybody there who does the self breast examination every month. And even if you have not been doing it, it's not too late to start. It's very, very important. And we want our girls, the thing about the breast is that we like to say October month is breast cancer awareness. So we need to do all these talks on breast health. But Dr. Jennifer and I we talk like once per month, first Tuesday in every month. We talk about breast health. They call B health because we want people to understand that you need to take care of your breast every day. Every day, someone is being diagnosed with breast cancer. So we feel that we should not wait until October month only to talk about breast. So today I'm going to talk a little bit of the breast and want to give every young person, older person, if you're a young person, you can start examining your breast from the age of 20. At 20 years old, we want to encourage our girls to examine their breasts. If you have, a older, I should say middle age, when your period is there, just like I think it's 5 or 7 days before the period, or you go ahead and have a specific time when you would check your breast to see if it feels different. If you're a postmenopausal woman, you want to choose one day of that month where you can examine your breast, if it's like the 15th or the 16th. But the whole idea is that if once per month, you can examine that breast. If there is any changes in the breast, you will notice it because it'd be a part of you. You're accustomed of looking at the breast. And you'd be like, something is different. Now, a lot of time we women like to say, oh, it's nothing. I'm not going to follow up on it. But I just want to encourage you, if it looks different from the last time you examine it, please contact your doctor. And I like to demonstrate when you're doing your breast self-examination, you're going to lift your arms above your head and just 4 fingers on your breast. You want to do like circular movements on the breast, all around, from the posterior part, which is the back of the breast, forward, and you do that all the time for both breasts. And next, you stand in of the mirror and just look at the breasts. I mean, they're yours. Look at it, see if there's, it's normal for one side to be a little bigger than the other. And that's quite okay. But if it looks like you're having, I'm going to show you some of the little signs of things that it might look like. If it looks like it's having anything different, if there's a little dimp in there, like a little dent, or if you have any discharge, excuse me, like anything that looks different from the last time you examined the breast, you want to make sure that you check it out. It says monthly exam of the breast are and underarm areas may discover changes early. And as we said, you can begin as early as age 20. It says here, I don't know if we all know that, but breast cancer is the second only to lung cancer as a cause of cancer death in America. Out of every 7 women, out of every woman, like it's diagnosed, out of every 7 women will be diagnosed with breast cancer in 2023. Unfortunately, we have radical mastectomies where you remove the breast. A lot of people don't want to go through the whole trouble of having chemotherapy, losing their hair, and some people choose just to remove the breast. But that's something that you have to discuss with your doctor. Some people want to do that, but maybe we don't need to act so, quickly. We can think about it. Pray, very important. Pray about it and ask the Lord to direct your path in what you should do. We have also here some signs, just some little things that you can look for when you do that breast self-examination during the month. The most common is like this thickened area, like, the breast is kind of hard. It wasn't like this last month. And then you have like a little discharge. Discharge doesn't necessarily mean that it's something there, especially maybe if you have kids or you breastfed for a period of time. But at a certain time, after 3 months of breastfeeding, you should not be having like discharges from the breast just like that. And some people take longer. Maybe some people will have discharge 2, 3 years after breastfeeding. But if this is like a sudden onset of discharge on the breast, especially if it's bleeding, clear, yellow, you want to just definitely check with your doctor. And then we said changes in the outer look of it, the contour, if there's any redness. You know, a lot of us have pain in the breast. And I think it's, I would say, kind of normal because the breast gets a little tender, especially just before your menstrual cycle. But if, you know, it's kind of red and it's really hurting, you want to definitely check with your doctor to see what's going on. And your nipples, if for some reason your nipples look like it's gone in, like we call it inverted, that is a sign of, you know, like early detection of some type of breast disease, not necessarily that big word that we don't want to call all the time. But we have here, yes. And so examine the breast is fine. Self-breast examination is amazing, but with your mammogram, when you do a mammogram, it shows you a lump in the breast, not shows you, yes, you can see a lump in the breast as early before you even feel it. I'm going to go to the mammogram part first. I think it skipped one slide. Yeah, right here. So you see how this lady's redoing the mammogram, and a lot of people claim that the mammogram is so uncomfortable. I mean, it's not the best examination, but it's worth every ounce of it. I mean, as a technologist, I always talk to my patients. I said, let me know how much compression you can take. You see the sizes of these lumps here? The first one on the top, that big one, that one, you will feel that lump, but then that lump has grown and gotten very large. The one after that, coming down, that's also, you know, one that you will feel and it's like, oh my gosh, it's already grown. But the one at the beginning, like the last lump, this lump, you can only see this on a mammogram. You would not feel it. So if you do your yearly mammogram, you will feel this, see this lump, and we can be able to do further examinations, maybe an ultrasound to see if it's solid. And then if possible, we'll definitely do further examinations like biopsies to see if it's positive for any disease. And that's why it's very important for us to do our annual mammograms. And I know some people get busy, especially we as women, you know how we do everything. We get busy and we forget to examine our breasts, forget to get our mammogram because we just take care of everybody else. But I want to encourage us all. If you have not, if you've missed last year, please go and do your mammogram this year. This is just some images of what the breast looks like. The mammogram image. Like we have the image on the left. This is like a 2D mammogram. Before, we used to do 2D mammograms where you can see something there. But now with the early technology, we have a 3D mammogram, which takes tomographic slices of your breast, where it kind of cuts it like slices of bread. And you can see the image on the right. Let me see, my right, yes, your left. That's been circled with that yellow outline there. That's an area that's like a breast sign, looks like a breast cancer. And that's detected on the 3D mammogram. That's the exact same images on the 2D, but because of the technology improvement, it's better seen on the 3D mammogram. So especially for women that have really dense breasts, I mean, the breast topic is like a whole topic all by itself, but I'm gonna just keep it as simple as I can. But people who have dense breasts, that have the different types of breasts, it's kind of a little difficult for us to see pathology, any like abnormalities on it. That's why we encourage, especially people with dense breasts, to make sure your doctor send you for a 3D mammogram test to be done. It picks up anything we can see early, and if we can pick up any abnormality as soon as possible, we can get rid of it, treat it, and it's like if you never had it before. This is another picture here of like what I don't know if you can see it. better than me over here. But the left side, my left, the fatty breast, you can see that little area, that circle. And the next side on the left, on my right, is the dense breast, which you can see it's like on that side. It's, as I said, it's a little more easy to see different breast diseases on a fatty breast compared to a dense breast. That's why it's very important that, as I said, we as women continually. I mean, it's a process. I don't know how some people take it so lightly. Breast cancer is real. We as women need to take that time to look after ourselves, and not being is that sometimes you just have to take a stand and say, I am going to be taking care of joy just for a few minutes per day. You have your devotion, you sit and relax. The world that we live in is just fast going. Let's go, let's go, let's go. Take a moment and spend time with Jesus and take care of our bodies. This is some of the long term. I'm not sure if we can see it clearly here, but it's just saying that, our behavior, like training. I mean, sometimes we like, oh, I don't want to go out walking. I'm going to stay home and watch the TV. I mean, I'll encourage you, take that walk. I mean, the late eating in the nights at 6 o'clock, if possible, as early as you can, you try to have that last meal. And then you can have like a light snack in the evening. I had a very difficult time doing that because who make food so beautiful and so tasty? Of course, we always want to eat, but when we think about our health and our lifestyle, it's very important that we don't eat late and then we go to sleep, fall asleep on the couch, and it goes, in a different direction from there. So we want to also try to keep healthy because, as we said, we are the people that have to carry and finish the work of the gospel. If we don't do that, the Lord said he's going to get the rocks and the thing to carry on his work. So we have to try our best as citizens of the kingdom to do our best so that we can be able to finish God's work. And then in conclusion, we said, take your time. I'm trying to see where this is. Sorry. I was trying to get this across this part, but anyhow, it's saying in order for us to spread the word of God, we have to be strong, we have to be healthy, we have to take those moments in our life just to reflect on Christ, just to enjoy nature and do what's best for our body. We know what we're supposed to do, eating healthy, fruits and vegetables, water, walking. And I just want to encourage us as women, especially, take time for yourself so that we will be able to keep the family together and also we will be healthy. Thank you very much. I'll give you time for anybody have any questions or answers. I
Yes,
don't know if I
Joylin,
went
there's a
over my
question.
time.
Yeah, there's a question in the chat. How often should a postmenopausal woman do mammogram?
That's an amazing question. You know why? Because we have that question all the time. I'm going to stop sharing my screen so I can see everybody. That question is something that comes up all the time. As you get older, your chances of getting breast cancer increases all the time. So as you get older, you have to continue examining your breasts, still do your mammograms. If you're a young person and you get breast cancer, it's more likely to spread to your body because of your hormones and it can kill you. So postmenopause, you don't have that hormone. It's a slower process of trying to spread to your body compared to someone that's young. But as a postmenopausal woman, to answer that question, you need to still do that monthly examination. Just choose a day of the month because we don't have a period to work with 7 days before or after your period. So choose like the 15th, the 10th, one of those days. And every month, try to do your breast examination the same time so that if anything looks different, if during the process of the month, before you come to that date when you want to examine it, if it looks different, don't delay. Check with your doctor and get the answers you're looking for.
No, Jolene, thank you so much for reminding us of that so important topic to check, do a breast examination. So very important because early detection save lives. So true.
Amen.
Now, I know some people are kind of squeamish about going to do the mammograms because of the pressure that, you put in the breast and having this thing, squeezing the breast together. Um, is there any research, anything that's done saying that that can cause cancer because of the pressure squeezing and damaged tissue and what have you?
And that's an amazing question also, because we have had that several times. People says, well, that's radiation and the pressing the breast, it's going to give you breast cancer. But we have not come up with any results of any research that shows that having a mammogram gives you breast cancer. Having a mammogram saves your life because the breast tissues make up a fatty tissue, and that just compresses your breast so that we can see what's behind the tissue. What I tell people, when you're having your mammogram, you are the patient. The patient is always right. You said to the technologist, ma'am, I think you're hurting me. No, your mammogram not supposed to be uncomfortable, that you're in pain. It's supposed to be just taut. We said like just tight, just enough so that we can be able to perform that examination. If you're feeling pain, the technologists need to stop and start over and talk with you and give you just the amount of compression that's comfortable. Not like pain, not like, it's not, it shouldn't be uncomfortable, but comfortable enough to perform that examination. So I always tell people just a little few minutes of discomfort can save your life, going forward.
Okay, thank you. So that question, the earlier question, so you're saying that women postmenopausal should do yearly mammograms.
Oh, yes, please.
Yeah.
That's
Okay.
once you're up and about, like people say, well, I'm 80. I'm saying you still need to do it. You're walking for health reasons, the insurance is going to pay for it. We encourage that you do your mammogram yearly, because I'm telling you, so often people say, well, okay, I'm not going to come this year. And I'm telling you, 90% when they come the following year, or 2 years, 3 years, especially 5 years down the line, about 99% of the time we find something there. Because what happens most of the times when you do your mammograms, the doctor might say, oh, I don't see anything there. It doesn't mean that there is nothing there, but there's nothing that's showing there. Now, if there's something there, the next year you come and be like, oh, there's a little something coming up that was there last year that we did not see. But because you came this year, we could have correct that, compared to if you wait next 5 years, where that area could have grown and make matters a little more complicated in treating that problem.
Mhm. Okay. So I know another concern for women is bone density. As women get older, I guess sometimes they end up with osteopenia, osteoporosis, and so forth. So can you tell us the difference between the osteopenia and osteoporosis, and what can we do to?
Yeah, I was trying to get some slides on that. I didn't get there yet. But yes, the bone density, we call it bone mineral density, which shows give you an idea of, like, the amount of calcium in your bone. Because we have like when you're younger, the bones are strong. I mean, you can jump and do stuff. As you get older, especially postmenopausal women, we women just can't win. Once we see those estrogen and those hormones are not there anymore, our bones tend to get a little more brittle. Osteopenia is it's like early stages of the bone changing, but it's not danger, like it won't cause any harm really. It's nice to continue eating. People say the doctors would recommend calcium. Calcium is good, but sometimes people say calcium will give you have like increased amount of kidney stones and different stuff. You get medication for one thing and then it sometimes result in giving you something else. But calcium can help in that situation. Osteopenia, as I said, is not that bad. But when you have osteoporosis, meaning your bones are getting thin, even more than, normal, your chances of getting a lifetime fracture in 10 years increases. And that's what the bone density shows. If the bone density shows that your increased lifetime of having fracture is like great, we'll definitely have to put you either on calcium or you get like an injection. I think, I know it's Prolia. They have different injection that they use. I mean, you can talk to your doctor, as we said about it, like to help strengthen your bones. People will just call. I'm literally cough and have a fracture in their ribs. People will just walk and have a fracture in their tarsal bones. That is the toes of your bone, the metatarsal areas, and the top part of your toes. But osteoporosis is like thinning of the bone, and it makes you very susceptible of having a fracture very easily. If you fell, I can tell you, definitely there's going to break some part of your body. So we kind of encourage naturally, if you have your green, your spinaches, your anything green, your string beans, these things has calcium, which is good for you compared to having to take the supplement, the pills, if you can avoid it. I mean, if you're in a situation where you have to, I encourage people to go ahead and take those supplements, and then eventually you can try to get the natural means of strengthening your bones health.
Excellent, excellent. I always believe in eating food to give you the
Nutrients.
nutrient that you need, because the body knows exactly what to do with your food, how much of it needs. Taking these supplements, especially calcium, be very careful with calcium, because calcium causes hardening. It also can cause hardening of the arteries, and we do not want
Mercy.
that. And so we have to be very careful with taking calcium. Because I read somewhere, so, if we're not taking the appropriate calcium or the right type of calcium, instead of going into the bones, it's going to like form a coating outside of the bone. And it's just going to be like cement. When you have cement, you can hit
Oh,
it and it will
yes.
crack. So it's the same thing going
Mm.
to happen to that bone. I read a research showing women in some part of Africa, Swiss chard. They ate a lot of that. Swiss chard, yes, dark green
Oh,
vegetables, and their calcium levels were much higher
oh.
compared to levels, like the calcium level that we'll find here in the United States. So again, eating rich dark green vegetables, we
Mm-hmm.
can offset osteopenia.
This.
Yeah, we
Mm-hmm.
can offset that,
Correct.
because it has the calcium in there, and the body knows exactly what to do with that type of calcium compared to the calcium that supplements that you're gonna take.
Amen. They
So
said, but sorry, go ahead.
no, I was gonna
Apologize.
ask anybody else if they have any question. Yeah.
I have a question here that says, but she didn't answer as to whether doing it yearly. Yes, please. You must do your mammograms yearly. As I said before, as you get older, the chances of you getting breast cancer increases. So we encourage you to do your yearly mammograms, your monthly breast self-examination, as long as you can walk. I mean, once you're up and about, I encourage people to do it. If it's like difficult and you bedridden or you're on a chair and it's complicated, I mean, I understand that maybe you might not be able to go, but once you're able, I encourage everyone to do your yearly mammogram, because as I said, as you get older, your chances of having breast cancer increases. That's what research has shown.
Mm. Yeah. Any other
Anybody
questions?
else?
Mhm. Okay, it doesn't seem like anyone have any other question.
I got a question, Emma.
Okay, sure, go ahead, Linda.
I was just gonna ask if you do get to a point where you can't um go, is it possible for them to come to you?
Say that again, because if you cannot go to have your mammogram, if we will come to you. Is that the
Is it
question?
possible? Yes.
Well, they have like a mobile bus but they have it like different times of the year it comes to the village. I should say like the state or your church, but it's not like we can come to your home and do a mammogram in your house. You have to like come outside. The bus comes certain time of the year. I think it's in October. It goes to different locations. If for some reason, you're living somewhere that you can't like traveled. But you can talk to your like I don't know where you guys live, but each state have like resources in order for breast care, and someone should be able to advise you on that situation. If you have a bus in your area, there's a bus now. Few people have buses that go to different states and locations and will do mammograms if the person cannot come out. But I don't think we go into the homes. You have to be able to at least come outside of the house.
Oh, okay. Thank you.
You're
Yeah, I
welcome.
guess it's the setup of the machine, I guess.
Correct.
Yeah.
Correct. It has to be like on this
Yeah.
bus.
Yeah, because I
Yeah.
know we have portable X-ray machine to do
That's
chest X-ray and
different.
stuff like that, but
Yep.
they haven't come up with a portable mammogram.
Exactly. That's correct. And you as a nurse, you know what I'm talking about. That's
Yeah,
right.
yeah,
It's
yes.
yeah, that's the truth right there. And I just
Yeah.
want to encourage us that um we can live like a healthy lives. And a lot of times we feel that, oh my gosh, I don't have time for this. I don't want to do this. And even the young girls that's coming up, people tell us all kind of stories. This thing is going to be so hurtful. Don't do it. It's not that bad. We've been there. Miss Emily can tell you.
Mhm, mhm,
We've
mhm.
been there, we've done that. It's not as difficult as sometimes people make it sound. And if for some reason, like people like to ask the question, what's the difference between a diagnostic mammogram and a screening mammogram? Anybody want to answer that question? Anybody knows? What's the difference between a diagnostic mammogram and a screening mammogram? I know we have quite a bit of smart people out there. Somebody knows that answer? Yeah, I think I see Miss Amy Winger. Like, yeah, look like you know that answer. Miss Amy, she's smiling. Yeah, does anybody want to give it a try? We have diagnostic mammogram and screening. Who wants to try? Miss Lee? Miss Leanne Turbo? No? Okay. It's Phyllis. I think Phyllis is going to give that a shot. Okay, no.
Yeah,
All right,
yeah,
so
uh,
give up. Okay, Dr. Emily, let me see if you
yeah. No, no, I was just saying, a screening is where you go to check to see if you have anything going on with your breast. So
correct.
they will do the X-ray, the mammography, where they check the different layers of the breast and do the different slicing and what have you, and check to see if you have anything there. But if you do have something, that's when they're going to need to do biopsy. So it will involve some sort of a biopsying of the tissue that
All right.
they're looking at.
All
That's
right.
my
Well, that is like
terminology.
wonderful. Great. Thank you, Miss Emily. That's awesome. Because what happens with the diagnostic mammogram, as Nurse Emily says, as you come and have your screening, if for some reason we see something there, if anything looks different from the prior mammogram, and also want to remind everyone, if you are moving from a different state or a different city or a different doctor, it's nice to get your prior images to take with you so that the radiologist can compare them to see if there's any changes. The only way they can know if something has changed is if they have that prior one. So when the doctors compare it, if they see anything, they're like, you know what? Okay, Joy, we need you to come back for a diagnostic mammogram because I see something and we want to do additional images just on that little area. We're going to compress that with a special paddle just to compress that area to see if we really seeing anything. That little lump that I see there, sometimes when you compress it, it disappears. The thing about lumps that we feel, yes, there's a lump there, and then we will do a mammogram, but I have something called calcifications. Calcifications, you cannot feel that. You can only see it on your mammogram. So when you come in and we said, oh, there's something looks different here. There's different shapes of the calcification that can look suspicious. And you can only see that on a mammogram. That's just encouraging us again. that mammogram is important. And as we said, then is when you're going to have to do a diagnostic. Also, when would you do a diagnostic? If for some reason you're like, oh my gosh, I can feel something here. There's a discharge on my breast. I just had my mammogram a couple of months ago. You will call your doctor, go into your doctor. They're going to do a diagnostic study. We're going to do ultrasound. We're going to do mammogram on that area. And the radiologist is going to look at that images immediately that same day. The screening, they can do it the next day, but the diagnostic is the law that they have to look at it the same day and give you results so that you don't go home worrying the whole night. Oh my goodness. As you know, I had a mammogram and it was abnormal. And that night, before I could have had my additional images, I had radiation, I lost my breast, I lost my hair. I mean, this is all the things that went through my mind. I had chemotherapy. I mean, you think about so much. So it's very important that when we find something or if you feel something, that we communicate that, you know what, I see something here, we might have to do biopsy. We can talk to your doctor. We're going to send this results to your doctor. And some people said, no news is good news. I don't believe in that. You have a mammogram, whatever it is, I would like to have my results, doctor, so that I can have it in my hands and see that there's nothing there. So it's important that you follow up with your doctor in getting your results.
Wow, that was deep. That was very important because a lot of us don't think about moving from state to state or from not even state to state, just from one doctor office, one radiology office to another, you know. That's,
Yeah,
because sometimes insurance change and you were going, let's say, at Florida Hospital
right.
to do mammograms, and now the new insurance that you have, they don't accept Florida Hospital. You can go to Florida Hospital. You might have to go
That's
to
right.
healthcare central, whatever, the other hospital or other centers to do it. And there you go. The doctor, they do not have that comparison. Very good, very good. Good to know. I guess cysts can also be another questionable when you're doing a mammogram. Because if someone has a cyst, that doesn't mean it's abnormal. It's a tumor.
That's
So
correct. Amen. So that's why, go ahead, sorry.
no, I was gonna
Yeah,
ask
so
you.
that's we said we have, go ahead. What was the question? I'm sorry.
Yeah, no, that's what I want to say. So how does a cyst show up on the mammogram? Can the doctor tell it's a cyst, or we have to go through that diagnostic testing also if you have a cyst?
Well, most of the times that we have different types of cysts. We have simple cysts and we have complicated cysts. Now, most of the times when you do a mammogram, if your cyst has like a smooth border, the next time we have this conversation, I'm going to get you some images of what a smooth, supposed to be normal cyst, benign, compared to what might be a complicated cyst that might have something there. The cyst looks different. But then the only way we can confirm if this cyst is really a cyst that we need to be concerned about is by doing ultrasound. Ultrasound shows you if the cyst is a solid cyst, meaning that if it has like blood flow and different stuff, it's like, oh my God, we need to do biopsy. Or just a simple smooth edged cyst, because some of us women have very cystic, we call it fibrocystic disease, fibrocystic breast, very lumpy. I mean, these cysts can have some big cysts and it's going to be very painful. It's more common in young girls, like Dr. Emily. I mean, I keep calling you Dr. Emily, Nurse Emily. You understand, it's like the younger girls most of the time, 20, 25. But we do not do a mammogram on a young person under the age of 30. Most of the times, if you feel something, we do an ultrasound. If you have a family history of breast cancer, we will have you do a mammogram at the age of 35. But if you feel something and we do an ultrasound and we're like, oh my, this doesn't look right, then we will do a mammogram to confirm that what we're seeing is real. But to answer the question, not all cysts or every time you feel a lump in your breast, it's necessary breast disease, but you still want to check with your doctor if it's especially abnormal. I mean, if your breast is like that and the doctor knows and you're aware of it, that's okay. but you still want to make sure you take a close look that if it's anything that from the norm, you want to follow up on that.
Okay, wonderful. Wonderful. Thanks again. Thanks again, Ms. Shirley, for coming and sharing with us your knowledge about this important subject. And I know our audience appreciate you very much. And we're going to have you back again so you can share more about the different things that you're doing, especially relating
Breast
to
world.
women. Yes, because we women, we need to take care of
Yes.
ourselves. Because if we do not take care of ourselves, we cannot take care of the rest of the family. We're the one who always taking care of the family. And,
Amen.
and a lot of times we neglect our health. And then when you do take stock, you are laying in bed and can't do a thing for your family. So let us take heed and
Right.
spend some time doing our walking, drinking more water, eating our fruits and vegetables, recognizing those 8 laws of health. Very important. And going for our different yearly screening for a different checkup, follow up with your doctors, get the care that you need so that you can be around to take care of your family. Thanks again. Okay, so I'm going to stop
Thank
recording.
you.